This meeting is being recorded.
We are already 2 minutes into the webinar. Can we start, Dr. Purnima?
Yeah, sure. If you think it's okay. I thought we had many more registrations, so I was wondering if we should give it a couple of minutes.
Yeah, we can wait for a couple more minutes.
I can see Mrs. Vinci Trubhuwan is here. Maybe she can let us know. I mean, if it's okay to start, we should be waiting for at least join. Good afternoon, Mrs. Vinci Trubhuwan. You're here, I can see.
She says,
yes, I can see you. I had wished, I think somewhere you were not able to hear me.
Yeah, you were muted, I think.
Okay.
We can?
How are you?
Yeah. I'm well, thank you. How are you?
Good. So I can't see how many is attending.
16 is what I'm seeing. Yeah.
Okay.
We had close to 100.
and there's like 14.
114 registrations. So I'm just confused whether we should start or wait. I mean, we should be waiting too long also because people have joined. should be kept with.
Maybe we can start doing, let them come, keep coming or something, because since it is first.
So good afternoon, thank you, Mrs. Vinci. Good afternoon, everyone. I am Dr. Punima Prabhakaran, and I'm Senior Research Scientist at the Center for Chronic Disease Control, which is hosting this event today along with Annie. A very warm welcome to all the attendees to this seminar. Along with my team here at the Center for Chronic Disease Control, we are very excited to have this opportunity finally to start a dialogue with the nursing community on the very important issue of climate change and its relations and impacts on human health. I will not get into the technical part of this discussion because my colleague, Ms. Sunila Dixit, research fellow on our team, is here to do that for you today. This is only the first of a series of conversations that we're hoping to have with you. But I just thought I'll share a little personal reflection on, I'm a physician to start with, and I've moved into public health practice for the last 2 decades. But if I think back, to my earliest job when I joined as a duty medical officer back in Bangalore and Chinmaya Mission Hospital, or if I think of the last job that I did actually as a practicing clinician, some of the fondest memories I have are the conversations that I used to have with the nurses who were on the ward duties or in the OPDs or anywhere with me. And I don't know why that is. I think it's some of the closest associations that I've built over the years, whether it was with the staff nurses or the student nurses who used to be around me. I just realized what a big role that the nursing community plays in the delivery of healthcare services, whatever the level of healthcare, whether it's the tertiary hospitals or where we used to go for our rural health postings in the rural areas. The nurses play a very big role. The doctors do their job of seeing the patients, examining them and making the diagnosis, but actually healing the patient is the role of the nurses, because you deliver the holistic package of not just making sure that they're taking all the treatment that they're supposed to take, but also keeping a conversation going with them and making them feel better. So healing the world, I think, is a big part that the nurses do in healthcare services. And I think we are starting to have a conversation with you about the role that you will play in healing the planet. So I think we have had a lot of conversations with physicians and healthcare specialists. And I think a little late in the day, we come in contact with the nursing community. It should have happened much earlier, but I think the nursing community has a very big role to play in dealing with the adverse impacts of climate change on human health. And rightly so, when we connected with Annie, Mrs. Tankam Gomez was saying that I think this is an important part that is missing in our curriculum, and we need to start from scratch. And we are very happy to do that. So our team is starting to put together from today a very interesting seminar series to bring you on board on the whole conversation around climate change and health. And we'll be very happy to work with you, not just in building your capacity and awareness around this issue, but also to work with you, handhold you to the process of what you can do on a day-to-day basis to address this very important public health issue. So with that, I'm going to turn it over to my colleague, Ms. Sunila Dixit. She's the research fellow on our team who's put this together for you. And please feel free to interact with the team. And I think Sunila will let you know that how interactive she wants to keep this seminar. So handing over to all of to Sunila, and welcome again to all of you. Thank you for joining us today.
Thank you, Dr. Purnima, for the introduction. Hi, everyone. I am Sunila, and I work as a research fellow for the Center for Chronic Disease Control. And as Dr. Purnima said, we have specially planned a series of webinars for you on topics that are centering around climate change and health. And today is the first one of them. And I'll be talking about climate change and its impact on human health. So before we start with the webinar, I just have a few points to get across to you. So to keep the session interactive, I have like drawn out a couple of questions for you. So they will be questions presented through the poll feature of Zoom, and you can just select answers when the questions are presented on your screen. And we will also have a Q&A session at the end of the presentation, depending on how much time is left. But anyway, if you have questions during the session, you can type it out in the chat box. Master, is there anything that you would like to add?
No, Sunila, thank you. You have highlighted. The only thing that I wanted to add is that please write your questions in the Q&A box. That will make our task much easier to take questions. And if you're not able to type your questions and if you want to speak to us, please raise your hands. We will give you the speaking rights so that you can talk to us. Thank you.
Okay. So I'll just share my screen now. Okay, so before starting with the presentation, let's talk about the basics of climate change and its concepts. And before starting the session, I have a question for you guys, just to see how much of the basics we know. Masud, could you please present the question on the screen?
Yeah, sure, Sunila.
Question is, when you hear it's unusually hot today, is that about climate or weather? Do we have answers, Masru?
Are you not able to see it on the screen?
I mean, I can see only the question.
Okay, we are getting responses. 12 people have fed their responses thus far. But
Okay.
in order to see the results, we will have to end the poll, which
Okay.
I want. Yeah.
So let's wait for a couple of
Yeah.
seconds.
Yeah. Yeah. Okay. I think we can now end the poll and see the results.
Yeah.
Can you see it now?
Yes. Yeah. That's interesting. 50% have answered it's climate. It is about climate, and 50% have answered it is about weather. So the correct answer is weather, actually.
Yeah, I've stopped sharing now. You can go ahead.
Yeah. Okay. So the reason that I asked this question was because the terms climate and weather are often used interchangeably, but there is a lot of difference between these two terms. And before we talk about climate change, it is necessary that we know what climate is actually. Weather is the condition of atmosphere over a short period of time, and this time might range from minutes to months, whereas climate is how the atmosphere behaves over a relatively longer period of time. uh, Weather is the state of atmosphere describing the degree to which it is hot or cold, humid or dry, clear or cloudy, whereas climate is the composite weather conditions, like it is the aggregate of all the weather conditions of a region, which includes all the factors such as temperature, humidity, precipitation, sunshine, averaged over a series of sorry averaged over a series of years. So for example, I am from Mumbai, and if I had to describe today's weather, I would say it's a little cold and dry. Recently, Mumbai has been experiencing cold days, surprisingly. But if I had to describe the climate of Mumbai, I would describe it as warm and humid because Mumbai is on the coastal side of India, the climate tends to be warm and humid. The basic difference between weather and climate is a measure of time. So weather is the short-term changes in the atmosphere, whereas climate refers to a long-term averages of daily weather. Moving on, now that we know what is the difference between climate and weather, I will just take you through the climatic zones of India so that you have a better idea of what climate is. As you can see on the coastal side of India, the climate is warm and humid. And if we move towards the northwest part of India, the weather is hot and dry, and this covers some parts of Rajasthan, Gujarat, MP, and Maharashtra. Towards the central part of India, starting from Madhya Pradesh, the climate zone is composite, and composite displays characteristics of hot and dry, warm and humid, as well as cold climate. If you go towards the top, towards north, which is Jammu Kashmir and some parts of northeastern states, the climate is cold, and you will see that there are little lavender patches over here, and it says it is the temperate zone. So temperate zone represents the environments with moderate rainfall spread across the year, with mild to warm summers and cool to colder winters. So this lavender patch that is here, it is actually where Bangalore is present in Karnataka. So as you all know, Bangalore always has a pleasant climate throughout the year. So this is where the temperate zone lies. Now that we know the basics of climate and weather, it is safe to talk about climate change. What is climate change exactly? It refers to a change in the state of climate over a long period of time, typically which is decades long. And it is identified by the changes in the mean and or its variability in properties over an extended period of time. Now, what does that mean? It means change in the average temperature of the planet and the variability in properties such as temperature, humidity, and precipitation. The causes of climate change are twofold. First one is natural, which includes volcanic activity and solar cycle. And the second cause is human-made, which includes burning of fossil fuels, use of plastics, and deforestation. As you can see from the pie chart, like us humans are responsible for most of the climate change that is happening now. And this climate change has started to happen since 1800s. Why I say 1800s? Because that's when the industrial revolution started, and industrial revolution brought in production processes on a large scale, which involved the use of fossil fuels to power them. So that is how climate change started happening since 1800. According to a recent report which was released in 2021, scientists are now able to link human activities specifically to climate events. And they also state that the natural processes such as volcanic activity and solar cycle, their contribution to climate change is almost zero. So which is quite concerning because we humans are causing a lot of damage to our planet. Now, I mentioned burning of fossil fuels when I spoke about human-made causes. So I have a quick question on fossil fuels for you. So the question is, fossil fuels came from fossilized remains of plants and animals from long ago. Is this statement true or false? Do we have enough answers, Muslim?
Hello.
Yeah.
Yeah. People are still putting in their responses. Let's wait.
Okay.
Okay, I'm ending the poll and we can see the results.
Sure. So yes, most of you got it right. Fossil fuels have actually come from fossilized remains of plants and animals that died like millions of years ago. And these fossil fuels are usually high in carbon content. Some of the examples of fossil fuels include coal, which we normally use in the generation of electricity, and it is also used for cooking in some rural parts of India. Coal, in terms of emission, is the most carbon intensive fossil fuel that we can burn actually. And another example is petroleum, which we use in transportation, of course, and for energy generation. And third example is natural gas, which is composed mostly of methane, and it is used for electricity generation, heating, and cooking, and as a fuel in certain vehicles. The impact of fossil fuels on our environment is quite concerning actually. It can lead to land degradation due to mining and drilling. This is because fossil fuels occur in the earth, and to extract them we need to use processes such as drilling and mining, and in the process it leads to degradation of the land quality. It also leads to water pollution because the waste that is generated during the drilling and mining is often let out into the water sources such as oceans and seas. It also causes air pollution due to emissions. Of course, when we burn fossil fuels, green emissions are released from vehicles and power plants, and it also causes ocean acidification. Ocean acidification occurs when the oceans absorb a lot of carbon dioxide, and in turn, the acid level of water increases. So what happens is the ecosystem which is present within the ocean, which includes all the sea life and the plankton and coral reefs, all of these get affected due to the acid content in the water. Now, when we talk about climate change, we cannot not discuss greenhouse gases and global warming. Greenhouse gases are those that help in trapping the heat and warm the planet. Global warming occurs when too much of these gases get trapped and there are not enough outlets for these gases to escape, leading to an increase in temperature. Some of the greenhouse gases of concern are carbon dioxide, which is emitted through burning fossil fuels, solid waste, and other biological material. And it is removed from the atmosphere when it is absorbed by plants through the natural biological carbon cycle. Second is nitrous oxide, which is emitted during agricultural land use and industrial activities, as well as treatment of wastewater. Third is fluorinated gases. The examples of fluorinated gases are hydrofluorocarbons, perfluorocarbons, and sulfur hexafluoride, which are synthetic greenhouse gases that are emitted from a variety of industrial processes. And the fourth gas is methane, which is released during production and transport of coal, natural gas, and oil. It is also released as a result of livestock and other agricultural practices and decay of organic matter in municipal solid waste landfills. Now, all of these gases, they have different properties, and these properties affect how the temperature increases of the planet. So the influencing factors for global warming are how much of the greenhouse gas is present in the atmosphere, like how much is the concentration of the gases present, how long it remains in the atmosphere. So for example, carbon dioxide, when carbon dioxide is released, 40% of it still remains after 100 years. Even nitrous oxide, it also stays in the atmosphere for a little over 100 years. Fluorinated gases stays in the atmosphere for a much longer time, which is tens of thousands of years. And methane, on the other hand, relatively stays in the atmosphere for a very short period of time, which is around 10 years. The Earth is now warmer by 1 degree Celsius than it was in 1800s due to the increasing greenhouse gas emissions. So, and sorry, I missed out on the third point. So the third influencing factor is how effective it is at trapping heat. So when I talk about how effective the greenhouse gases are at trapping heat, I'm talking about global warming potential. As you can see, carbon dioxide has a global warming potential of 1. And if you see on the pie chart on the right side, carbon dioxide accounts for a majority of greenhouse gas emissions, which is 76%. But on the other hand, fluorinated gases, which account for only 2%, have a global warming potential in the range of thousands to 10,000. So that makes fluorinated gases much more dangerous and potent than carbon dioxide. So since we are talking about greenhouse gases emission, there is one quick question for you guys. I just want to check which sector do you think is contributes the most to greenhouse gas emissions?
Last few seconds. Okay, I'm sharing the results.
Yeah, okay.
Yeah, okay.
Can you see it, Sunil?
So, yes. So many of you have answered industrial processes, then followed by healthcare and then energy. The correct answer is actually the energy sector. And energy sector accounts for 73.2% of the global greenhouse gas emissions, followed by agriculture, then industry, and then waste. Within the energy sector, energy use in industry contributes the most to GHG emissions, followed by transport and energy use in buildings. I will also talk about healthcare sector's contribution to greenhouse gas emissions, which is not included in this pie chart. And this is actually a problem that we are trying to address. Healthcare sector contributes a lot to emissions, but they are never accounted for officially in any of the sources that government presents. So the healthcare's climate footprint is actually 4.4% of the global net emissions, which is equivalent to annual greenhouse gas emissions from 514 coal-fired power plants. The major source of emission for healthcare sector is the healthcare supply chain, which includes production, transport, and disposal of goods and services. That accounts for 71%, followed by emissions directly from healthcare facilities and healthcare-owned vehicles, and then followed by electricity, steam, cooling, and heating. Now, I spoke about greenhouse gases, greenhouse gas emissions, and global warming. So let's talk about greenhouse effect. Uh, Many of you might have seen a greenhouse, which is basically a glass structure wherein the plants are kept, and the glass walls help in absorbing the heat generated from the sun, which eventually helps the plants to make their own food through the process of photosynthesis. Similarly, in greenhouse effect, what happens is when the solar radiation hits the earth, some of the radiation is absorbed by land, oceans, and atmosphere, and the remaining is then radiated back into the space as infrared light. But what happens when there is an excess of greenhouse gases present in the atmosphere? Uh, a lot more solar radiation gets absorbed by the atmosphere, land, and oceans, and only a little is radiated back into the space. So this results in extra trapped heat and higher global temperatures. An important point to be noted is that greenhouse effect is not all bad. In fact, we actually need it to survive on this planet. In the absence of greenhouse effect, the temperature of the earth will be very, very cold, and we wouldn't be able to get on with our daily lives. So the only problem here is that when the concentration of greenhouse gases increases, it actually leads to an increase in average temperature of the planet, and which then makes the greenhouse effect bad. So speaking of rising temperatures, this is how the temperatures have risen over the years from the period of 1880 to 2020. The blue bars represent cooler than average years, while the red bars represent hotter than average years. And as you can see, since 1940s, the trend has been an increasing one when it comes to hotter than average years. In the year 2020, you can see the temperature has already risen by 1 degree Celsius. And rising temperatures will also cause the sea levels to rise. And for that, I have another question for you guys. Masur, can you present the question, please?
Sure, Sunila.
Before that, Masroor, I think hand raised by one of the participants. Do you want to take that first?
Okay.
Okay.
Vijay, I think Vijay.
Yes, just a second. Hi, Vijay. I have allowed you to speak. You can, if you have a question, you can unmute yourself and talk. Vijay, are you there? Okay, in the meantime, we can run the poll.
Yeah.
Can you see it now?
So the question is, why are sea levels rising due to global warming? We often see in news that reporters are saying that sea levels are rising and temperatures are also rising. So what do you think is the reason for that?
Eleven responses so far. I'm waiting for a couple of more responses. Okay, great. 13 responses. Here are the results.
Yeah. Okay. Okay. So most of you got it right. Answer is actually ice glaciers are melting and seawater is expanding due to warming. Sorry. Yeah. So sea levels are actually rising because of global warming. Since temperatures are rising, ice caps are melting, which is then adding water to the sea, and sea water is also expanding because it is warming. Uh, you can see from the graph from 1995 to 2020, sea levels have risen by 3.4 millimeters per year. And what are the direct impacts of rising sea levels? Coastal communities are more at risk because of frequent and severe flooding. There's also the risk of destruction of their livelihoods and destruction of tourism economy as well. Um, so global warming, as we saw in the previous slides, global warming leads to climate change as a result of warming temperatures. A United Nations report from 2018 states that a rise in global temperatures should be limited to 1.5 degrees above pre-industrial levels, which is what it was before 1800s, before the Industrial Revolution started. And anything beyond that will mean serious problems for our planet. Because we live in an ecosystem where everything is intricately interconnected with each other, the consequences of climate change are not only limited to warmer temperatures, but also include severe droughts, strong floods, forest fires, and storms. Uh, Earlier, scientists had prescribed a 2 degrees limit for halting the climate change. But considering the gravity of situation and considering the fact that we have already warmed the planet by 1 degree Celsius, the scientists have now pushed back that value to 1.5 degrees. Now the number 1.5 and 2 degrees might seem like a small number, but the impact that it can have on our planet is actually pretty huge. So what does it mean when the planet warms by 1.5 and 2 degrees Celsius? It means that more number of people will be exposed to severe heat, sea levels will keep on rising, and there will be extinction of species of vertebrates, plants, and insects. There will be destruction of ecosystems, permafrost, and crop yields. And whatever, at all of this that will happen at 1.5 degrees Celsius, the effect will be even more the effect will be even worse at 2 degrees Celsius. As you can see, at 2 degrees Celsius, all of these impacts of global warming are 2 to 3 times worse than what it would be at 1.5 degrees Celsius. So it is absolutely essential that we keep the temperature rise in check. We don't have a lot of window actually left now because we have already reached the 1 degree Celsius mark. And if we don't take any action in the next 2 to 3 decades, we'll already have warmed our planet by 1.5 degrees Celsius. So now that we have spoken about climate change, what is climate and weather, what is climate change, let's move on to the next part of the presentation, wherein I'll be talking about the impact of climate change on human health. Before that, I have a quick question for you guys. Mastur, can you present the question, please? So the question is, which of the following health risks are caused by climate change? And the options are malnutrition, mental health issues, respiratory illnesses, and all of them. I would encourage all of you to participate in the poll because it is completely anonymous, so we won't be able to know who answered what.
Okay, I'm sharing the results.
So many of you have said respiratory illnesses and all of the above, and no one has selected malnutrition. Okay, That's interesting. Um, yeah, the way climate change impacts our human health uh, is actually a very complex issue. So there are vulnerability factors that come into play, but also the health system capacity and resilience, which affects how we are exposed to different climate change exposure pathways. So the vulnerability factors include demographic factors such as the age profile and sex distribution of the population, geographic factors such as the topography, biological factors and health status, such as the genetic makeup of the population, and if there are any health risks that the population is particularly vulnerable to. Social political conditions, if there is any political unrest in the country, if the country is actually under authoritative rule or democratic rule, socioeconomic factors such as the standard of living of population, and health system capacity and resilience includes leadership and governance, health workforce. We need to consider if the doctor to population ratio, hospital beds to population ratio, nurses to population ratio is up to the standard. Health information systems need to be in place because we need a solid database when it comes to climate sensitive health risks. And of course, we need to have funds in place because then we will be able to ensure we have essential medical products and technologies, and we'll be able to deliver service more efficiently. And vulnerability factors and health systems affect how we are exposed to certain pathways, which include extreme weather events, heat stress, air quality, water quality and quantity, food security and safety, vector distribution, and ecology. All of these three factors come into play to see how they affect the climate sensitive health risks. And these risks include injury and mortality from extreme weather events to heat related illnesses, malnutrition and foodborne diseases, and non-communicable diseases. These are just some facts about climate change and its impact on human health, just to provide you a better picture. Between 2030 and 2050, climate change is expected to cause additional 250,000 deaths from malnutrition, malaria, and heat stress. The direct damage cost to health is estimated to be around 2 to 4 billion US dollars per year by 2030. And the countries that contribute the least to climate change are the ones that suffer the most because of insufficient health infrastructure and funds. Now, why is this? Because these countries mostly belong to low income category, and these are mostly small island nations which depend on natural resources for their livelihood, and their economies are run mostly by tourism. And the fourth factor is that climate change affects the social and environmental determinants of health, such as clean air, water, sufficient food, and secure shelter. So I will be talking about how climate change impacts the transmission of infectious diseases. But before that, I just want to quickly explain what are the dynamics of disease transmission. Now, many of you might have come across this epidemiologic triangle, which consists of host, agent, and environment. So the agent is the one that causes the disease, which can be a microbe or virus or pathogen. Host is the one that harbors the organism and is affected by the disease. The host could be a human or animal. And environment is what brings out the interaction between the host and agent and allows for the disease transmission. And between host and agent, sometimes there is a middle entity called vector, which helps in transferring the agent to the host. And this vector could be insects like mosquitoes or ticks or snails or rodents such as mice. So there are certain climatic factors which affect disease transmission. First is temperature. It affects the incubation period of pathogens, and Increased temperatures can actually create suitable environment for reproduction of certain bacteria. Temperature also affects the spatial temporal distribution of insects. So there have been incidences where mosquitoes have changed their habitat from lower latitude to higher latitude region, which has then led to geographical expansion or shift of the diseases. Second is precipitation. Unusual precipitation patterns can result in disease outbreaks. They can also accelerate the larval development of mosquitoes and affect the dissemination of waterborne pathogens. An increase or decrease in humidity can affect the propagation of pathogens and vectors. A decrease in humidity in colder regions has found to affect the propagation of influenza virus, and an increase in humidity in warm areas has found that it can accelerate the propagation of dengue virus. Wind can act as a mode of transportation for a number of pathogens, viruses, and fungal spores. Sunshine hours can interact synergistically with the temperature to favor the multiplication of certain bacteria, such as Vibrio cholerae, which is responsible for cholera. Climate change is actually starting to affect how the infectious diseases spread in India. For example, dengue outbreaks have become severe over the last 2 decades in India. It is now spreading to hilly areas as well. And among Himalayan states, Himachal Pradesh and Uttarakhand, and northeastern states such as Arunachal Pradesh, Manipur, Sikkim, and Nagaland have become more dengue prone over the years. Similarly, malaria is also shifting from central India to southwestern coastal states of Maharashtra, Karnataka, and Kerala. And states in north and northeast are expected to become more malaria prone. For chikungunya, the number of clinically suspected cases have more than tripled from 2013 to 2017. In 2013 and 14, Bihar had no cases for the disease, but suddenly in 2017, it recorded 1,249 cases of chikungunya. So this is how vector-borne diseases that are caused by mosquitoes are being affected in the way they are transmitted across populations in India. So when we talk about climate change, there's normally a lot of discourse happening around how infectious diseases are spread, but there is a little talk about how non-communicable diseases are affected. There is actually a lot of impact on how the non-communicable diseases are occurring in the population. More frequent and increased intensity of heat extremes can cause heat stress, which can then lead to cardiovascular diseases, respiratory diseases, and cancers of skin. Increased temperatures and less rainfall can lead to higher ground level ozone and other air pollutants, and increase in airborne pollens and spores. So this can also lead to cardiovascular diseases and respiratory diseases such as chronic bronchitis and asthma, and cancers of respiratory organs such as lungs and trachea. The indirect impacts include impaired agriculture, reduced food yields, and food insecurity because of extreme weather events such as droughts and floods. This can affect the nutritional status of population and lead to overall poor health. Extreme weather events such as fires, floods, and storm can also affect the mental health of the population, because the population will be going through trauma and impaired livelihoods and impoverishment. One of the major impacts of climate change is the heat wave. Heat wave is defined as a period of abnormally high temperatures, more than normal maximum temperature, that occurs during summer season. A recent study conducted by Banaras Hindu University observed a spatio-temporal shift in the occurrence of heat waves with a significantly increasing trend in 3 regions of India: the northwestern, central, and south central. The reason for this has been the reason for the worsening heat waves is attributed to increase in night temperatures and increase in humidity. According to the Lancet Countdown on Health and Climate Change report, which was released in 2019, in India, 45 million additional heat wave exposure events were witnessed in 2014 as compared to 1986 to 2005. The health effects of heat waves include heat cramps, exhaustion, and heat stroke, which can often cause death. The impact of climate change on mental health is less known. It is a good thing that there has been a lot of awareness happening around mental health, but there is not a lot of awareness on how climate change can also impact the mental health. Increasing frequency and intensity of extreme temperatures and weather events can actually lead to increased competition for scarce natural resources such as water and fossil fuels. And this can lead to an increase in stress and anxiety. A study that was conducted among the Hurricane Katrina evacuees reported that 63% of them experienced either moderate or severe symptoms of post-traumatic stress disorder. In India, also, we can see the effect of climate change on mental health through the increasing occurrences of droughts that are then leading to a rise in incidents of suicides among farmers. In the recent years, there has been a new term that is coined, which is called eco-anxiety. It refers to the mental toll on people when they understand the magnitude of losses due to climate change and the inaction by those in power. Moving on, we should talk about injuries that happen due to climate change. It is obvious that when there are extreme weather events such as cyclones and hurricanes and extreme floods and storms, there is a damage to properties happening, but and that can also result in injuries. Extreme snowfall and rains can also increase the risk of accidents. Outdoor workers and those working in poorly ventilated hot conditions may be may at the increased risk of injury. When Mumbai was flooded in 2019, there were 21 deaths and 8 people who were injured. And also when the cyclone Fani happened in Odisha in 2019, there were 64 casualties and 160 people were injured. So we cannot downplay the risk that climate change brings when it comes to injuries and casualties. Some time ago, I asked you a question about what are the health risks of climate change, and I had included malnutrition as one of the options. It may not be directly obvious how climate change can actually affect the nutritional status of population, but the consequences of climate change, such as droughts, floods, and storms, can actually affect the agriculture scenario. It can lead to destruction of the crop yield and destruction of agricultural land. It can also cause mass migration, which then might force people to leave their lands behind. Indian agriculture is heavily dependent on monsoon. So the scarcity of groundwater can pose a major threat to agriculture. Increase in drought-prone areas will adversely affect the cereal production and animal husbandry assets. In the map, you can see the agricultural vulnerability of India. The areas that are in orange are drought-prone, which includes the states of Rajasthan and some parts of Gujarat, Maharashtra, and Karnataka. And then there are flood-prone areas in northeastern part and cyclone-prone areas, which includes the states of Kerala, Tamil Nadu, Andhra Pradesh, and West Bengal and Odisha. So all of these vulnerabilities can affect the way agriculture is being practiced in India. It can also the loss of livelihoods due to climate change and purchasing power of rural poor can adversely affect household security. So it can affect the way we are eating food, the way we are able to buy food. The Global Hunger Index, which was released last year, ranked India 94th out of 107 countries, which is a worrisome fact about our country. So the Global Hunger Index is calculated on the basis of total undernourishment of population, child stunting, wasting, and child mortality. So considering India ranks 94th out of 107 countries, we really need to think about the malnutrition status of our population. So I spoke about how climate change affects health and affects our planet as well. So let's talk about how can we tackle climate change at an individual level. First of all, invest in energy efficient appliances, check for star ratings, replace all of your regular bulbs with LED bulbs. Doing this will be good for your own pocket as well as good for the environment. If possible, switch to renewable source of energy for powering your houses. Nowadays in the recent times, a lot of organizations have come up which provide renewable sources of energy. Third is save water. Fix your leaky taps, time your showers, turn off the tap while brushing teeth. Avoid use of plastics. Look for sustainable options for carrying and storing stuff. When you're going for grocery shopping, always carry your own bags and carry your own tumblers for coffee and tea. Carry your own steel straw instead of using the plastic straws. Separate your kitchen waste from non-biodegradable waste. Segregation of waste at source helps in saving money and helps in saving our planet as well. Eat more of local produce. The more you eat imported products, the more you are contributing to climate change via the way of transportation, because importing food means using transportation systems, and that means using fossil fuels. Use bicycles and public transport whenever possible. Plant trees in your surroundings because they add to the oxygen levels, and sensitize people around you about the impact of climate change on health. Next, let's talk about what we can do to protect ourselves from climate change and its impact on health. Dress up to cover yourself from extreme sun rays. Always use a sunscreen while stepping out, so as to prevent the risk of skin diseases and skin cancers. Use umbrellas to protect yourself from sunlight. Keep yourself hydrated to prevent the risk of heat stress. Use mosquito nets while sleeping. Use mosquito nets while sleeping in case your surroundings have a lot of mosquitoes. Clear out any tires, storage containers which may act as breeding sites for mosquitoes. During monsoons and events like floods, ensure you are drinking clean water, either boiled or filtered, to avoid any waterborne diseases. Wear masks while stepping out if the air quality is poor. And maintain your physical health. Exercise consistently to prevent non-communicable diseases such as diabetes, obesity, hypertension, and any heart diseases. Adopt a diet that covers all macro and micronutrients. And lastly, educate yourselves and others about the health impacts of climate change. These are some of the resources that you can refer to if you want to read more in detail about climate change and how it can affect human health. Before ending this presentation, I just want to say that some climate change effects are actually irreversible. So even if global warming were halted at 1.5 degrees Celsius, the sea levels will keep on rising and that change will be irreversible for centuries. So now that we have already reached the 1 degree Celsius warming, we need to really keep in check the warming up to 1.5 degrees Celsius, and anything beyond that will be actually very dangerous for our planet and for the human health as well. So let's start by educating ourselves with how climate change affects our entire planet. Thank you very much for listening to me. And if you have any questions, and I'm open to taking those questions.
We have one question in the chat box, Sunila. So, Dr. Shubhangi says, when we protect ourselves from sun, how can we get vitamin D?
So it depends on when you are going out in the sun. If you are going out early morning, it won't be actually harmful for you. But if you are going out during like extreme hot hours, like during afternoon when the sun is at its strongest, like during 12 p.m. and after that, then that and at that time, then you need to protect yourselves from sun.
Okay, we had just one question. Anyone else, if you have any question, you can put it in the Q&A box.
Or you can raise your hands as well if you would
Yeah.
like to. We still have a couple of minutes, right, Masood?
We are at 4:30
Okay.
sharp. I guess we don't have any questions.
Okay. So
Yeah. So the recording of the session, I guess we have a question. Sorry.
what are the initiatives going on large scale to fix this? So there are policies and treaties that are being launched at the international and national level, and I really wanted to talk about those policies and programs, but I couldn't include them in this presentation because it would have taken up a lot of time. Like that topic could be another presentation in itself, but just to be brief, the government of India has launched a national action plan on climate change and human health in the year 2018, and that plan also has several missions under it. uh, and then there are state action plans which are then being customized according to the climate variabilities of the state. At international level, we have the Paris Agreement, which is ratified by the member states of United Nations. There is also the United Nations Framework on Climate Change Convention. So there are a lot of actually declarations, treaties that are being ratified on the international scale. Maybe that could be another topic in this series itself. Yeah.
We have a hand raised from Vrushali Kulkarni. Could you unmute yourself and speak? Vrushali? Okay. There's a follow-up question. Yeah.
Are these plans successful enough? In what ways we can ensure? It's very hard to answer that question actually, because while we have set the limit at 1.5 degrees Celsius, we have already reached the warming, we have already warmed the planet by 1 degree Celsius. And then there are a lot of political aspects when it comes to implementing these plans. And then there's a lot of back and forth happening between the developed countries and developing countries. But even so, there are certain examples that we can look up to, and what ways we can ensure we need to, and first of all, we need to ensure we are aware of what climate change is. And once we are aware, we need to ensure we need to make our voice heard, and that could be through using social media or writing our opinion pieces in news outlets, and just keeping ourselves aware by keeping a tab on what is happening in the space of climate resilience as well. But yeah, it's a very difficult question to answer. If Dr. Purnima has something to say on this question, or even Masroor. for that matter.
Yeah, just to say that, you know, there are a number of global as well as national and regional programs and policies, but as always, there's a huge gap that happen between making programs and policies and actual implementation on the ground. But that's not to say that there isn't an effort. As Sunila has explained, there is within India the National Program for Climate Change and Health, which is working at the national level, but also with institutes of experts across, with different domain experts across the country to work on all the different aspects of climate change, ranging from heat to air pollution to vector-borne diseases, flood disaster management. So there is a lot of effort that is going on, but the program and the framework is at the national level. Implementation is happening at the state level. So there's often challenges in doing that because it's not the response by the health sector alone. It requires a very intersectoral kind of coordination to respond to the climate crisis. But there are little steps being taken, and I think it's a collective effort that needs to happen with all departments, all representatives of the health sector, as well as, you know, urban and city planners and other departments and ministries. So yeah, there's a lot of effort, but like I said, it requires collective action. These conversations are happening with you as well.
Yeah. Also, one thing I would like to add, which could be done at an individual level, is you can talk to your legislators, your politicians about such issues and demand them to, you know, work on that, bring out policies which are, helpful, which are which works towards, reducing greenhouse gas emissions from the country. Thank you. If we don't have any more questions, we can close, I think. The recording of this event will be shared with each one of you very shortly.
Yes, we will be sharing this presentation. Okay. Should we end this session then, Masu?
Yeah, sure. Thank you so much, everyone, for joining. Thank you.
Thank you all of you.